we'll start. Thanks for coming. I simply want to update you from a county health officer and an infectious disease standpoint, kind of where we are, just so everybody is on the same page from a county perspective and city. So the first thing I'm hearing about is, why did I go ahead and close the basketball tournament? For me, it was a no-brainer. My job is to protect the state, the citizens, to use some common sense with this. When you see the NCAA, the NBA, soon to be the NHL, completely canceling their tournaments. In fact, where I went to undergraduate at UMass, they were on the court about to play the A-10 game against VCU, walked off the court. Another NBA player was just diagnosed with it. And it just made no sense, because we really don't have an idea yet of what's in the state. We already have a case. I'm sure we have more that we don't know about. And I'd rather be proactive, as I said yesterday, than reactive. And so that's why I did that. I stand behind it. It's the right thing to do. And I wouldn't sleep at night if I put hundreds and hundreds and potentially thousands of people at risk. Let's face it, we know so far that it's kids do well if they get infected. That's not really who's having the problem. But if the kids spread it and bring it home and bring it to grandma and grandpa, the ages where there really is a problem, then we got issues. And then it spreads rapidly and it can lead to big problems. So when we look at the elderly, for example, we've worked with the nursing homes here in the county to restrict visitors. Again, common sense, talking to the employees at the nursing home. Anybody that's sick stays out of there. That kind of thing. Again, proactive, not reactive. We are going to be meeting this afternoon on a county and city level to discuss some options as to look at funding and that kind of thing, and there'll be more information coming on that. Again, rest assured there's great communication here between the hospital, the providers, the county, the city, emergency management people. There's a rumor about testing that I've got to clarify once and for all. The United States has done, admittedly, a very poor job in developing the testing to be able to be done widespread across the country. Every state is struggling with this. Our state lab has 2,700 tests available, period, right now. The viral media, which is the stuff that you have to put the swab in when you take the sample to be able to do the testing, is not widely available yet. Hospitals have it. I'm not aware of a bunch of clinics in the state that even have it. Our clinics do not have it. We have requested it here at Public Health. It's yet to arrive. So really the only testing in this county that can be done right now is through the hospital lab. We are working with our providers to be sure that we are not randomly testing people right now with a limited amount of testing available. So the rumor that at Mesa Walk-In Clinic you can come in and get tested is absolutely not true. They have no viral media there. So there is a hotline here at the County Health Department for questions that has been set up quite rapidly, just again to disseminate information and answer the questions that providers and the public have. There is also a hotline through the state for providers, that be nurse practitioners, physicians assistants, docs, to discuss cases and see if they're appropriate to test. I said this yesterday, I'll say it today, and I'll say it probably forever. This is a moving target. That's why the NCAA did not cancel those tournament games until this morning. Everything's changing, and the public needs to realize that we're going to change things as we go based on national guidelines, working with the state, and we have to adjust things. I had a discussion with the symphony about an hour and a half ago. It's a large gathering. And we talked about the pros and cons of maybe not having that event on Saturday. Why? Because who goes to the symphony? A lot of older people. I leave it absolutely to the organizations to make those decisions, but when I'm dealing with a basketball tournament and thousands of people, that's a different discussion. So I'm looking right now, we're saying, well, there are no national guidelines of what size constitutes a large enough gathering to say, hey, you probably shouldn't do this. Maybe 250 people? I don't know yet. We're guiding, we're not making decisions for people. We're communicating. That's what you want in your county. And again, we're working with the state. The state needs to continue to give us guidance. We're certainly not going to go against them. We just had an hour-long conference call with the county health officers across the state. And we talked about testing, various issues, logistics, and I'm proud to say I had great support from other county health officers about the basketball tournament because everybody got it. I want to protect you guys. The other message is, I'm calm. I'm not panicked. Remember, we're just trying to deal with this as a state. We have one confirmed or pretty confirmed case in Sheridan. There are more out there, so let's talk about it, get systems set up now, because we're gonna have more. I can guarantee you we're gonna have more. And let's just go ahead and be ready for it, so we're not scrambling. And I think that's the key thing. I think that covers a lot of what I wanted to say right off the bat. And I think if I can be clear, please let me know and I'll take questions. Yes?
So you and others have talked about how contagious it is. Can you kind of talk more about that, and if there's a comparable disease that you know about that's similarly contagious, or if you can just expand on that?
We're still learning about how contagious this is.
Mm-hmm.
Seems to be pretty contagious. I mean, look at the Utah Jazz. I mean, one guy got it, and the next thing you know, Donovan Mitchell has it. So we think it's fairly contagious, and as I mentioned, was it yesterday? We still think an awful lot of people have very mild symptoms or may not even be symptomatic at all, and they may be able to go ahead and spread the virus. So just because we're sitting here right now with no symptoms, it's possible in the future that somebody may have it, be sitting here, maybe just have the sniffles that we normally would ignore, and be spreading it unintentionally, of course. So we don't know that yet.
Can you, on the quarantine, can you talk about when someone should begin quarantining and when that quarantine should end, when they can stop quarantine?
Well, the take home right now is that if you're in, for example, in close contact with somebody that has highly suspected infection or confirmed infection, family members, for example, from the time you really have integer contact, or if you're in a family situation, sometimes you could, there's no hard day when it starts, which pretty much the number right now is 14 days. Home quarantine, self-quarantine, not saying legally you can't move. We're not doing that, okay? And so, and remember, this virus, if you're talking about, gee, I walked by somebody that had it and I was 27 feet away, come on. It doesn't jump out of people. It's droplet spread, so that's 6 feet and less, and it's not for 1 second. It's consistent contact, okay, prolonged contact. That's the thought right now scientifically. Influenza, completely different virus, is spread similarly. It may be that this is more contagious than influenza because the population is completely susceptible. You know. So.
Yeah. So sorry, to be clear, if I have contact, say like the first of a month, like hard contact, and it ends that day, I should self-quarantine until the 15th,
14 days, yes.
14 days, okay.
That's the party line right now. That may change.
And then if, say I have symptoms on like day 4, should I wait 2 weeks from day 4? Like, I guess how does it change when I have symptoms?
If you're sick, you have to have gotten well in around 14 days, and that can be worked out with your provider, yes.
So when I first heard all this, I was thinking, wow, people are gonna be very upset. Just a few hours in, what's the backlash been like?
Depends who you talk to. Those of us in the medical field and those of us that have the kind of the knowledge about the science behind this and the medicine behind it, understand it totally. Look, I raised kids, they were in sports, I'm a parent, I know it's disappointing. I know that this is senior year for kids, I know that. But you know, we can't change nature here, and we can't change what we have to do as a society. And there are a lot of families involved, but I look at it as we gotta all be together and we gotta look out for the public good. And I would feel horribly if I just said, they're overreacting across the country and everybody's doing this and we're not. And then a bunch of people get sick. That's not right. And so I just somebody had to make a decision, and it happened to be here.
And then to add to that, there's no chance for a reschedule, and do they take your recommendation? Like, so let's say they came to you, hey, we wanna reschedule it. Is it your recommendation, or do you call the final shot? How's that really
Legally,
work?
I have the right to call the final shot, but I'm gonna work with people. I'm not gonna play dictator here. I had to do this as an infectious disease doc. I mean, I've got a fair amount of experience, not with COVID-19, but these kind of problems. Everything's a moving target. Maybe everything calms down when the weather gets warmer, people disperse, and it's harder to transmit this. And then everything has gone back down to a lower baseline, then everybody starts talking about maybe we have the tournament in the summer. Maybe it's not gone for good. Same discussion with the NBA. Same discussion. They're not sure where they're going with this right now. They just canceled the games until everybody can figure out how widespread this is gonna be. Look, we only have one case, but we're talking. We're getting something set up, and that's what's important. I think I'll cover one more thing about schools. There are no plans to close schools right now. There are ongoing discussions as to what threshold we would want in terms of number of cases in kids before we would say, okay, this is spreading quickly, we better close them down. It's a big deal for the county, it's a big deal for parents and families, for childcare, for people making it to jobs, for the school district having to figure out how to get classes online. It's a huge decision. It would be made absolutely in concert with school superintendent and the officials. There is no plan at all, no indication to do that whatsoever. The vast majority of the United States are just letting school go on as is. The reason I believe that some of the universities have closed is simply because there's communal living. People are in dorms, people are in frat houses, in sororities, where everybody's concentrated. It's a very different setting than your kid goes to school and goes home. And that's why these schools have done this. And that's also, again, being changed as we go along. So that's the update on the schools, which is not much of an update, except it just squashes the rumors that I don't want people to be throwing out there.
But it's also the travel, like colleges, school districts
Right.
are contained, we're contained to one community. The travel, and I think that's kind of the moving piece, like, can you talk about, like, you travel to New York, you're exposed to this population, you come back and then.
Well, travel is also confusing. Get questions all day long. Well, I've got a trip scheduled next week to Disney World. What do I do? Well, it's a balance between small, tiny risks, because look, Florida has 30 cases, 40 cases as of this morning. That's a big population, big state. It's a personal decision. No one in the United States is saying don't travel within the United States. No one's saying that I've heard. We heard the travel ban to Europe, but that's very different than travel within the United States. So, travel within our state. We can't live our lives paranoid either. We still have to continue our society and not panic. You've got to understand, this is not a situation that makes all of us have to stay at home and do nothing. We can't live that way. This is not that setup. Any other questions? Yes?
Maybe it's too soon in this moving target, but is there any indication if somebody, say, gets a mild version of this, seems to be recovered, are they immune from getting it the second time around?
Good question. No one knows for sure as to whether you can be infected a second time. They have seen a few people, for example, as we learn more about this virus, that seem to shed the virus a lot longer than others, but we don't know if they're actually contagious or not. The virus may be leaving their bodies, but it may not be something that can cause disease. There's one other thing I neglected to cover that I need to make clear. We are setting up the testing in the county based on availability of supplies, and we will be putting out more information as that becomes available. The goal is to keep people from thinking that I just go to the emergency room when I have a cold and a cough, and I'm going to overwhelm the emergency room and demand to be tested for COVID-19. We do not want that. That is not healthy for the community, it's not good for the ER, it's not good for our medical system. For those of you that have providers, or established relationship with providers, call their offices, talk to them. If you don't have a provider, or you can't get a hold of a provider, call the hotline here, and they will try to help you. Providers have been taught and told they can call and talk to the emergency room physicians, they can call the state, they can call us, and try to sort out who needs to be tested, who potentially could be infected. But I don't want my providers in the community to just have offices that say, oh, you think you might be infected, go to the emergency room. No. That's not good for anybody. We've got to communicate better, and we cannot overwhelm the system like that. It causes panic, misinformation. Stick within the system, and I call on my providers in the community to do that. As a physician that's been practicing in Wyoming since 1992, so we've got to do that. That was also stressed at a state level through the discussion with the county health officers. Anything else? Any other questions?
Initially, the decision was to play the games without crowds and then quickly turn into that. What prompted that change?
Okay, what prompted that change is a little self-contemplation on my part, and then finding out that every major college conference tournament had been canceled as of this morning. Many of those tournaments made those decisions this morning. When I got that additional information, I said, I gotta do this for the better good. I know parents are gonna be mad at me. I know that. But I gotta look out for the big picture here. That's when it happened and how it happened. Okay, thank you very much.